Shuncell Medicals developed Prostatype test system, which contains a Prostatype RT-qPCR kit and a classification of prostatic malignancy algorithm. It can provide prostate cancer prognostic guidance for professional healthcares. The system shall work according to a 5-step workflow. The turnaround time is approximately 8 hours. FFPE sample sectioning. Prostate core needle biopsy FFPE tissue blocks are the starting material for preparing the test system. They shall be transformed into one hematoxylin and eosin stained slide, serving as a map, and the sequential FFPE unstained sections that will be used for RNA extraction. Digital scanning. Professional pathologists can mark and note cancer cell tissue on the H&E stained slides, either by a traditional microscope or a digital scanner. Digital scanner is preferred. Scan the H&E stained slides and then mark the cancer cells on a computer screen. The scanned image can be marked or noted where cancer cells are, what pathological pattern they are, and how much cancer cell tissue can be used for the test. According to the formula, volume of tissue equals to the thickness multiplied by the area. Sample handling. In this step, you need unstained FFPE sections, the H&E stained slide, a disposable scalpel, and a 1.5 ml tube. Firstly, mapping the target tissue. Using its parallel H&E stained slide as a map to match with unstained sections. Marking the cancer region. Scraping. The target region containing cancer cells are taken out. This will be the raw material for the RNA extraction step. Prostatype RT-qPCR test. A commercially available RNA extraction kit for FFPE tissue is used for RNA extraction for scraped samples according to its instructions. Purified RNA solution is the input of Prostatype RT-qPCR test kit. Each RNA solution sample should be run as triplicates in RT-qPCR reactions. Light Cycler 480 Generation 2 is a recommended qPCR instrument, which can perform prostatype tests in a well-controlled manner. In order to measure 3 gene signatures and 1 housekeeper gene at the same time, Prostatype RT-qPCR kit developed as a multiplex RT-qPCR test. CPMA. Prostatype test system utilizes an algorithm to generate the final prognostic statement. It is called Classification of Prostatic Malignancy Algorithm, CPMA. It requires an authorization to log in. Then, input a new patient's clinical data and gene signature data. A specific kit code of this patient test can authorize the data input. Each Prostatype RT-qPCR kit provides 16 kit codes. CPMA has a reference database which contains historical patients' clinical follow-up data. The new patient compares its gene signature, age at diagnosis, PSA value, Gleason score, and tumour stage with the reference database. As a result, the most similar historical patients can be found, and their historical clinical outcomes are presented, such as their treatments and overall survival. This prognostic statement will provide a guidance for healthcare professionals to make a personalised treatment for patients. Healthcare professionals can authorise this prognostic statement as finally approved or rejected, according to their own professional acknowledgement. Shuncell Medicals.